Good afternoon. My name is Stephanie Clark, and I'm here to present our urgent care expansion proposal. And this is for MHA 618 Health Economics with Dr. Tarika Haynes. First thing that we want to look at is our microeconomic model. Our goal is to open an urgent care center here in Dublin, Ohio, which is approximately 20 miles from our flagship facility at Riverside Methodist Hospital in Central Ohio, or Columbus, Ohio. Why do we choose Dublin? Dublin has seen a large increase in population growth over the past several years. In 2010, the population of Dublin was about 40,000 people, and in 2020, the population has grown to about 50,000 people. The population of Dublin is also becoming more diverse in ethnic background, as well as seeing a shift in older and aging populations. Because we are seeing a population growth in Dublin, establishing an urgent care in the area would allow to have a greater number of patients, more convenience, and access to care. In order to be universally appealing, services provided at the facility will be diversified and offer additional services such as physical therapy, occupational therapy, health and wellness opportunities, as well as education outreach opportunities. When opening a facility, any facility, public policy needs to be considered just to make sure we cross our T's and dot our I's. With the urgent care here, we really need to take a look at the Affordable Care Act, or the ACA, which establishes that all medical plans cover emergency room visits. However, some policies will recognize that there is a difference between emergency rooms and urgent cares. Therefore, reimbursement may be different. And just knowing that going into this, knowing that co-pays and deductibles will likely apply. For the consumer, the out-of-pocket cost may be significant when seen in urgent care than, in an emergency department. For example, the cost of treating a non-life-threatening condition such as strep throat can be up to 5 times more in an ER than in an urgent care. So knowing that there is that appeal to an urgent care benefits us. Reimbursement rates may vary depending on the demographic being served. When establishing the urgent care, payer mix needs to be considered, as this will affect reimbursement rates. Private insurance versus Medicare patients will all be different. And that's another reason why we propose offering a diverse array of services that are going to be provided. Additionally, being aware of HIPAA and high tech are applicable to public policy to consider when establishing this emergency department. We must ensure that the facility is HIPAA compliant to protect PHI. Additionally, EMTALA, or the Emergency Medical Treatment and Labor Act, is a federal legislation that states that anyone seeking care in an emergency department be treated and stabilized regardless of the ability to pay. In recent years, it was determined that hospital-owned urgent cares must follow EMTALA standards. Should a patient present to the facility, they must be treated and stabilized or transferred for stabilization to a higher level of care. The facility cannot refuse treatment of a patient. So on to justification, we need to look at, when considering the urgent care facility, it's important to look to see if there's similar facilities in the area. If there's too large of a concentration of urgent cares or like type facilities, the location may not be ideal. Additionally, it's important to ensure that the model is successful and there is a demand for it in the area. We would also need to consider similar types of models in the area, not just urgent cares. These models would include things like freestanding emergency departments and minute-type clinics or quick care facilities or clinics that are located in shopping centers and drugstores. If there are places in the area that offer the same type of services, it's important to consider how our facility would be set apart. We would do that by offering a variety of services, and the customer experience will be key. Once we determine a need, we need to supply an experience that sets us apart from similar services. Financial relevance. It's important to make sure that we build and set up to understand the financials behind building and setting up an urgent care facility. It is estimated to cost between $800,000 to $1.2 million just to build and set the facility up. There will be variables in this cost as it's dependent on the size and the services provided. Once the brick and mortar costs are calculated, it's now time to consider the expense of the labor force. A careful analysis of the patient projections and staffing requirements will be important. Threading this needle of ensuring that you have enough staff to take care of the patients, but not too many, is definitely a financial consideration. Marketing is also a financial aspect that shouldn't be taken lightly. Marketing strategies can influence the financials of an organization, and marketing plans can improve the patient flow into the urgent care. It's also important to know that making profit for an urgent care is done by a very thin margin, and important to know to know what the facility's break-even point. From 2013 to 2016, the average urgent care visit received about $123 for reimbursement, and it's calculated the break-even point for the urgent care will be approximately 20 to 25 patient visits a day. Knowing this will help us prepare so that we know what we need to see to make sure that we break even and we can make a profit. Comparing and contrasting type facilities we need to make sure that we're considering apples and apples and oranges. Some of these facilities are like a minute clinic or a quick care type facility to an urgent care and emergency department. It's comparing apples and oranges. We'd have to be careful that when comparing similar services, freestanding ERs may be similar and similar to what the patients may need or the type of patients that they see, but they're still considered emergency departments, and reimbursement rates will be different, as well as the out-of-pocket costs for the consumer. Minute clinic type facilities may not provide as many services and that are available at our facility. Therefore, ensuring we are comparing apples to apples and oranges to oranges will be important. In conclusion, after careful analysis, we have determined that there is a need in our area for an urgent care facility. There's a large population growth, and the opportunity for an urgent care in the area is definitely there. Please let me know if you have any questions, concerns. I'm happy to answer them. Thank you. Have a great day.